We'll start off by stretching out the hip flexors in the front. So thrusting your hips forward, I'll show you from this angle here. So squeeze your glutes, slightly bend your knees, and tuck everything forward, and then extend back. This is not only going to help stretch out the hip flexors in the front, but it's also going to help to move that hip joint right in the hip socket. So you're just going to gently warm up with this. Again, keep your knees nice and bent, arch back, squeeze your glutes to tuck forward and back and forward. So this is a movement that may feel a little strange. You may not know even how to move your hips this way. Just try to do your best to mirror me as much as possible. This is actually a very therapeutic movement for your lower back and your hips, and to help stretch out the muscles, especially in the front of the hip joint. Now take a step back. If you're mirroring me, you'll take a step back with your left leg, and now you're just going to do the same movement, forward and backward hip thrust. You can put your arm out on the wall or a chair to help you balance, like I just demonstrated here if you're losing your balance. Now, why we're taking a step back is to now help to work a different angle of the hip joint in the hip socket. Just do your best here, tucking forward, making sure you're staying up nice and straight, and switch sides. Tuck forward and extend back. Stay up nice and straight. Now there should be no pain with this movement. And when I say no pain, you shouldn't have a pain that's higher than a 7 out of 10 pain, where 0 is no pain at all and 10 pain is the worst you've ever felt. Now let's work on the side to side motion to get a little slight stretch on the side. So you're almost going to like sit in your hip when you're doing this. So again, we're stretching out the muscle slightly on the sides now, but we're also helping to get the hip joint moving in different ranges in that hip socket. So there's going to be no lying down at all today. Everything's going to be done in a standing and sitting position. Just really try to exaggerate this movement. Shift your weight side to side like I'm showing you here. That will help you get a better stretch. Now we're going to move in a circular motion with our hips. So we've done all the ranges. Now we're just completing all of those ranges in a continuous motion. So I'll show you here from the side. It'll be better view here. So kind of tuck forward first, lean out to the side, extend back, lean out to the other side, and tuck forward. You're almost doing a hula hoop. Now this is a great exercise to do, especially in the morning if your hips are tight right deep in the joint. This is a great way to get the blood flowing there, stretch out your muscles, stretch your capsule out, your ligaments, tendons. Great exercise. Now we'll go the other way. As big of a circle as you can make. Really try to work those hips. Hips don't lie. That's what it reminds me of this movement. Just a few more here. Big circles, big circles. And if you're not doing this movement perfect, just bear with yourself. You'll get better. And we're going to stand on one leg. So stand on the left leg. You're going to pop up and bend the front leg, and you're going to rotate towards and then try to rotate away. So rotate towards, and we'll just do that for now. So cross your arms over, and we're just going to Stay in that one position, standing nice and tall, working that corkscrew motion inside that one hip socket, really making sure we're warming up all the range of motions of the hip joint in the standing position. Now take a step back, and we're going to do, so still standing on the same leg, take a step back, and we're going to open up in the opposite direction. Just do as best you can here. And now let's switch sides. So stand on the opposite leg, take a step forward with the other, bend it, and we're going to twist towards that side. So I try to show you a little bit on an angle here. So that front leg is bent. We're standing on that leg and twisting right towards it. Standing up nice and tall. And switch to the other side. So still stand on that same leg and bend that same leg, but step in the back and turn away. You should really start to feel your hips warming up. Let's get a chair, preferably one with handles. But for this one, it's not absolutely mandatory, it just helps a little bit. Now scoot yourself to the edge of the chair here, and we're going to open up our legs. So I'm going to turn to the side to show you a better angle, and we're going to now slowly and controlled let our knees fall in and out. Make sure you're standing up nice and tall, so use your hands right by your hips to keep your back nice and straight. And just perform as great a range of motion of the hips falling in and falling out as best you can. There should be no major sharp pain when doing this motion. No numbness, tingling, or burning. So now we're going to step feet together and extend one foot out, and we're gently going to do that in and outward rotation. So this is similar to the last exercise we did when we were standing, twisting in and out. We're now sitting, so it's a different angle that we're twisting this motion in our hips. So that is why we're doing it here. Again, we're trying to get all different ranges of motion working in that hip. Now switch sides. Again, just do your best to try to rotate it inward and outward as much as you can. Now we're going to go on a slight angle, so about a 45-degree angle outwards, or 30 or 20, whatever makes you feel best, because we're going to be doing one more out. So if this is already your max, back it up about halfway. And switch sides. In and out, really making sure you're turning at the hip and you're feeling that hip joint move in that hip socket. Now we're going to try to step out as much as we can. Again, keep a nice straight back. Chin up, try not to look down. Feel that movement of the hip joint in the hip socket. Go ahead and switch to the other side. Same thing. Try to open up as much as you can and complete the inward and outward rotations at the hip joint. So these exercises are very great, especially to do in the morning if you have hip problems. We'd recommend doing these exercises at least once every 2 or 3 days. Every day would be ideal. So now let's just begin to mobilize the joint at even different angles. So now it's going to be up a little bit. So protect the knee joint, cross that ankle over the knee, and we're going to be kind of crouching back and then trying to stick our butt out here and really straighten our back. And crouching forward and really straighten out the back. So now our hip joint, our femur, that big thigh bone muscle is stabilized, and we're now moving our pelvis around that hip joint. So it's a completely different movement. All these movements before, we were more or less moving our femur in the pelvis, except for the one at the beginning when we were kind of tucking everything forward and back and doing the hip circles. So we're now doing that same type of motion in a seated position. It's all about the different angles here. Now we're going to pull the knee up and release down. We'll switch sides. So really make sure you're protecting the knee when you're bringing your ankle up to cross over your other knee. And same thing, slouch and stick out your glutes, and slouch and stick out your glutes. So this should not be painful. So if you're going at too much of a range where it's giving you back pain or anything like that, then just hold the static position if you can without doing the forward and backward motion with your pelvis. And protect the knee down, really guide it down to the floor. Now let's switch to the other side. So cross it again. Now we're going to hug our knee and let it go. And hug the knee and let it go. Again, it's all about moving different ranges. So now we're really getting a different range here, higher than any other positions in the acetabulum have been so far. It's a great mobilization exercise, great for stretching the capsule, and great for the joint articulating cartilage and muscles and tendons as well. If this is too difficult of a range, just do baby ranges. Just do an inch up and an inch back down. That's all I ask, is best that you can do. That's all I ask. You want to make sure that your body is comfortable with doing these stretches so that you're not forcing yourself past a range of motion that your body is telling you not to go past. Now slowly guide your leg down. Now we're going to work on the front to get a different angle. So turn to the side, grab that handle if you can, and straighten out your knee and then bend it. And straighten and bend it. So the back of your toes are completely glued down to the floor and your knee is straightening. So if you can only go this little range like I just demonstrated and it can't get fully straight, your leg, don't worry about it. I was a dancer and a gymnast, so my ranges of motion are quite a bit. So if you can only straighten your knee a couple millimeters or inches, and that is what feels great for you, then do that, and I'm happy with that. Put a chair on the other side of yourself if you need to, and just grabbing your hip and the handle next to you if it's not enough, so that you feel as safe and balanced as possible and that you're still benefiting as much as you can from these exercises. Now let's slowly twist to the other side. So rotate, see how my back leg is hanging off, and slowly glide it back and stretch out and bend. Again, if your knee can only straighten out a couple inches like I just showed you here, and if that feels good for you, just do that. So try to keep your back up nice and straight. Work the knee as much as you can comfortably. Getting those ranges of motions in those hips. So we're doing really good work here because we're working practically all the ranges of motion of the hip. So now we're going to grab a pillow if you can, and we're going to use that as a glider on the floor. So just extending back and then bring it forward. So if you can only move again your foot in a range where you're only getting a couple inches gliding backwards because it's too much of tension in your hip or your muscles or whatever the case may be, then just do what you can. So you see how I'm grabbing the handle and the back of the chair to keep balanced? You can also use a towel on the floor if you don't have a pillow like that. And if you're on carpet or something, perhaps maybe just using a plastic bag, a little plastic baggie to glide on the carpet might be what you need to do. Keep your back up nice and straight. Only reach back as far as you can comfortably. We're almost done here. Good, wonderful job. I want to thank you for taking time to do this video today. It's a great way to get blood flowing to your hip and getting that range of motion back in your hip if you suffer from any hip pain, especially deep in the socket. If you know anyone in your life who would benefit from this video just like you did, please share this video with them. And as always, please subscribe to my channel because once you do, you'll be notified first whenever I release a new video in the future. Thanks for all your support.